Welcome to Kidney Disease Management and Self-Care around COVID-19. Today's webinar brought to you by collaborative effort of a number of organizations that are based in the United States and United Kingdom. The organizations are following: RenalMate, the Renal Patient Support Group, the University of West of England, the Mission HQ, Renal Diet HQ, Well Within. I'll be your moderator for today's webinar, and my name is Nataliia Karpenko. Great to have you. The millions of Americans have been under the order of shelter in place for a number of weeks, and some of us in California started the shelter in place in mid-March. Entire country experiencing the pandemic as well as the world, and we are looking to flatten the curve by closing non-essential businesses, enforcing the social distancing, and helping to reduce the spread of COVID-19. That means that 316 million people in at least 42 states in the United States have been urged to stay at home. The number of the cases are still increasing across the world, but some of the European countries and Asian have been already experiencing flattening the curve, which means that the number of new cases drastically decrease in those countries. However, United States still experiencing a high number of the new cases. What is important to understanding about the flattening the curve? We have to keep enforcing the social distancing to be able to control the pandemic and have capacity within our healthcare system to assess patients who are experiencing COVID-19. The social distancing and isolation at home have been the best strategy to stay safe and protected from the COVID-19. However, there is a vulnerable group of patients as ESRD, patients who still have to go to dialysis 3 times a week. Those patients couldn't just stay at home and self-isolate. That's why it's very important to provide all necessary support and education for ESRD patients on hemodialysis, how they can protect themselves during the outbreak. Also important to remember that the vulnerable group of ESRD patients experiencing also the socioeconomical challenges. Many of these patients have to access the food in their local safe banks, and the CEO of American Kidney Foundation already have stated that they have been experiencing a lot of requests by renal patients across the country to help them financially to get access to food, afford transportation and medication. They're certainly working really hard in fundraising efforts, and if you're looking to donate to any nonprofits at this time, American Kidney Fund could be a wonderful organization to donate to save lives. I would like to introduce you to the agenda we'll be following on today's webinar. So first of all, remember this: the webinar consists of 3 parts. The first part is our science-based part speaking about COVID-19, the immunosuppressed, and also isolation, and what does it really mean for immunosuppressed patients. Shahid Mohammed from United Kingdom will be speaking about this topic. The following session will be dedicated to self-care for renal patients. We'll speak about PPE, also how to stay active and motivated at home with Wilson Do, the renal diet on budget, and how to follow ESRD and CKD diet will be presented by Nataliia, the renal dietitian. And the final speaker, Elizabeth Conrady, certified health coach, speaking about fear, anxiety, and self-care during the pandemic. The final part of the webinar is dedicated to the patient's experience. We invited Anel Aguirre. She is a post-transplant patient, and Wilson Do. He's been on hemodialysis for 3.5 years. And of course, the final part of this webinar will be addressing your questions. So make sure you submit those questions below. So thank you so much. And I'm really looking forward to speak to Shahid Mohammed and his topic of COVID-19 and immunosuppressed. Shahid, great to have you on this webinar, and please proceed.